Hi, Minister Holland. Pleasure to welcome you back to our show. Thanks for making the time.
Absolutely. Thanks, Fashion.
Minister, what do you know that the task force doesn't that's prompting you to take this action?
Well, I've had an opportunity to talk with experts all across the country and gotten very clear feedback on their thoughts on what the guidelines should be. And I think one of the biggest gaps is the caution the task force appears to be taking around false negatives, or false positives, rather. And I understand that. I certainly, having a daughter and having many women in my life, it'd be very stressful to get a false result. But it's much better to be screened and catch cancer early. That'll save lives. And dealing with some false positives, I think, is, to my mind, something that we have to look at. So I've asked the Chief Public Health Officer, Teresa Tam, to convene experts over the next 60 days. Let's take a look at the evidence and make sure we're giving women the best advice for their health.
Are you open to the possibility that those experts might come to the same conclusion as the task force? And I ask that only because I think the anecdotes you're hearing are the same ones I am. The experts you talk to, we interview as well. They've all said the same thing. It made sense to start at 40. So it was confusing, I think, to all of us to hear what we did today. But in the interviews that I've seen with members of the task force since, they have been steadfast in arguing that the data did not bear out the conclusions that anecdotally you and I have heard from others. Are you open to the possibility that the experts that are convened by Dr. Tam might come to the same conclusion as this task force?
Well, let me be clear. This is a science-based process. It has to be rooted in evidence and not feelings. And so as health minister, I greatly respect that, and I respect the scientific expertise that's going to be brought together. But like you, it was very confusing. This is out of alignment with what I was hearing across the country from experts. But this process has to be science-based, and I'm going to follow the evidence and follow the science. But from the experts I've been talking to, 40 seem to make sense. So this is confusing, but we're going to look at it very carefully and rigorously, convene these experts, allow Dr. Tam to take that lead and continue to have it be a science-led, science-informed process.
Ultimately, from a procedural perspective, if Dr. Tam comes back at the end of that and says, I've reached a different conclusion, what happens then?
Well, what's going to happen is they're going to lay out the evidence very clearly. And I can say that the evidence as it's been laid out is unsatisfactory to me and most experts right now. So we need much clearer answers. There's also been data gaps that have been identified. So I've asked the head of the Canadian Institute for Health Research, as well as Dr. Tam, her office, and the Canadian Chief Science Officer and others, to look at those data gaps and close them, and particularly for racialized individuals. There are certain demographic communities that are disproportionately affected by this that we don't have good data on, that I'm not satisfied was looked at carefully enough. So we need to make sure the rigor is there and that we have greater unanimity in the expert community around the path forward.
Can I ask, is it your sense that the level of rigor you would have liked to see apply was not applied, or that the data set is incomplete? Because it's two different things.
It is two different things, and I'll address each in turn. First, in terms of the rigor, it appears to me, talking to stakeholder groups and experts, that there was a lot of items that weren't looked at in the way that to the depth and to the fullness that they should have been, and that there are data gaps. Those data gaps, some of them are pieces that maybe the task force should have considered, and some of them are just actual data gaps where information that doesn't exist. Why I made that directive to officials to close those gaps. It's incredibly important that be done because women need clear health advice, and that has to be scientifically informed. It can't be run on a feeling that I have or anecdotal conversations.
Are you confident now that you have these questions in part about the rigor applied in the makeup or the effectiveness of this task force? There are a number of experts whom my colleagues have talked to, for example, who pointed to the fact that there are no oncologists who are among the voting members. Is there a problem with the makeup or the task force itself? And do you have any jurisdiction over that?
Yes, so there already was contemplated a regular expert panel review of this body that's responsible to inform us on preventative health. I've asked for that to be accelerated. I want that review to happen immediately. I want to make sure that we have the right body making the most up-to-date, modern, and informed decisions to guide us in public health. And right now, I've got major concerns in that area that have to be answered, not by me, but again by that expert panel, for that expert panel to investigate this process and the composition of the committee to make sure that it's reflective of what the country needs to provide clear and direct preventative health advice.
I guess what I'm trying to get at, though, is as minister, do you have everything I could read about it essentially is it's under the direction of public health, but ultimately public health reports to you. Like, do you have jurisdiction if at the end of this process, there are big red flags about how this goes down? And I don't know that to be the case, but let's say it is. Do you have jurisdiction to change the makeup of this, to change the fact that it exists, to replace it with something else? Like, are all those things under consideration?
Yes, Vassy, they are. But I think it's, I think a lot about precedent. And, while my heart and intention is clearly based in data and science and evidence, I have to make sure that our processes are rigorous and transparent, and that they could be reproduced in a circumstance where, God forbid, we had a health minister who was acting on a more ideological basis, which is why that expert panel needs to do its work and really undertake a rigorous review of both what happened and the composition of the committee. They're going to make recommendations, and I then have the power to act on those recommendations.
Just before I let you go, Minister, what do Canadian women my age, in and around my age, do with this information today? I listened to the scrum that you held earlier. You got a lot of questions about, do we just ignore it? Basically, because there are these questions, what is your advice?
Well, I have a daughter, and I would say to her, as I would say to any woman in this country, that it's extremely important that you have a conversation with your doctor, that you make sure that that conversation be about preventative health, that if you have any reason to believe, if you identify a lump in your breast, or if you have any reason to believe you might be at risk genetically, that you have that conversation and listen to medical advice and guidance, and to say that as quickly as possible, while still respecting science and data, we're going to ensure that we have clear national standards.
But just to point out what I know you're familiar with, there's millions of Canadian women who don't have a family doctor, who look to guidance from a national body like this one to determine what they should be signing up for, if they should be contacting someone or a center to get that mammogram. You're raising very serious questions about the veracity of what the conclusion that was reached today. Should Canadian women ignore it?
I think what Canadian women should do is go and have a conversation with a health professional when they have a reason to be concerned that they're at risk for breast cancer, and have that conversation with their health professional. We do have some women in the country who don't have access to a medical doctor, but if they have this kind of concern, then certainly they should put themselves in front of a medical doctor. And we're working in rural and remote communities, which are some of the circumstances where we have challenges with access to physicians, to be able to make sure that those are available. And as quickly as possible, we're going to make sure that these guidelines informed by science are out.
Minister, I'll leave it on that note. I appreciate you making the time for this today. Thank you.
Thank you, Vassy.